Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम द 28 ऑफ अगस्त 2019 शिफ्ट सेकंड का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। एक, a patient is diagnosed with gout. What type of food should be given to the patient? A. Low purine diet. B. High iodine diet. C. Diabetic diet. D. Iron-rich diet. Correct answer A. Low purine diet. 2. The process of communication includes A. Sender, message channel and receiver. B. Verbal, non-verbal message and channel. C. Message, media, channel and feedback. D. Receiver, message, sender and channel. Correct answer A. Sender, message, channel and receiver. 3. The hormone which helps in glycogenolysis is A. Epinephrine. B. Trypsin. C. Estrogen. D. Estradiol. Correct answer A. Epinephrine. 4. What is fremitus? A. Widened costal angle. B. Use of accessory muscles for respiration. C. Perceptible vibration felt through the chest wall when the patient speaks. D. Movement of the thoracic diaphragm during breathing. Correct answer C. Perceptible vibration felt through the chest wall when the patient speaks. 5. Individualized, comprehensive and consistent care provided by one nurse for the total period of care 24/7 is known as A. Case method. B. Team nursing. C. Functional nursing. D. Primary nursing. Correct answer D. Primary nursing. 6. Which of the following is not a common solution used for bladder irrigation? A. Potassium permanganate. B. Boric acid. C. Lactic acid. D. Sodium nitrate. Correct answer C. Lactic acid. 7. A cuff that is too narrow will provide what type of reading for the patient's BP? A. True low reading. B. False high reading. C. False low reading. D. True high reading. Correct answer B. False high reading. 8. What would be the dose of insulin in milliliter if 24 units of insulin is given using U40 insulin? A. 0.6 milliliter. B. 0.4 milliliter. C. 0.2 milliliter. D. 0.8 milliliter. Correct answer A. 0.6 milliliter. 9. The immunoglobulin that can cross the placenta and transfer the mother's immunity to the developing fetus is A. Immunoglobulin G. B. Immunoglobulin M. C. Immunoglobulin D. D. Immunoglobulin A. Correct answer A. Immunoglobulin G. Thus, pellagra is a deficiency of A. Nicotinic acid, B. Pantothenic acid, C. Biotin, D. Pyridoxine. Correct answer A. Nicotinic acid. 11. Ringer's lactate solution contains all of the following constituents except A. Chloride, B. Sodium, C. Potassium, D. Glucose. Correct answer D. Glucose. 12. Which of the following actions should not be done as part of first aid for poison swallowing? A. Keep checking the patient's breathing, pulse and level of consciousness. B. Look for clues like plants, empty packets and containers. C. Make the patient drink clear liquids and induce vomiting. D. If unresponsive, open the airway and check breathing. Correct answer C. Make the patient drink clear liquids and induce vomiting. 13. Which of the following statements is not true of operant conditioning? A. Law of effect is used. B. Responses decrease when reinforcements stop. C. Responses are involuntary and automatic. D. Learner's role is active. Correct answer C. Responses are involuntary and automatic. 14. If 500 milliliters of normal saline is to be infused in 4 hours, then how many drops need to be infused? The drop factor is 20 mega drops. A. 42, B. 46, C. 21, D. 38. Correct answer A. 42. 15. What is the normal range for specific gravity of urine? A. 1.006 to 1.010. B. 1.01 to 1.10. C. 1.100 to 1.160. D. 1.001 to 1.060. Correct answer D. 1.001 to 1.060. 16. Loud drum-like high-pitched sounds on percussion known as A. Resonance, B. Crackles, C. Hyperresonance, D. Timpani. Correct answer D. Timpani. 17. Identify the non-essential amino acid from the following options. A. Valine, B. Lysine, C. Glutamic acid, D. Histidine. Correct answer C. Glutamic acid. 18. The pyrimidine base that is present in RNA is A. Adenine, B. Thymine, C. Uracil, D. Guanine. Correct answer C. Uracil. 19. 1 teaspoon is equal to how many drops? A. 60 drops, B. 75 drops, C. 15 drops, D. 30 drops. Correct answer B. 75 drops. B's. When was the National Goiter Program launched? A. 1972, B. 1962, C. 1952, D. 1982. Correct answer B. 1962. 21. What is the average duration of the first stage of labor in primogravidai? A. 12 hours, B. 2 hours, C. 8 hours, D. 6 hours. Correct answer A. 12 hours. 22. The anterior fontanelle closes in children at the age of A. 12 to 18 months, B. 26 to 30 months, C. 20 to 24 months, D. 6 to 10 months. Correct answer A. 12 to 18 months. 23. What is the drug of choice, specifically for the management of convulsions in eclampsia? A. Diazepam, B. Betadine, C. Magnesium sulfate, D. Ampicillin. Correct answer C. 24. Which of the following classifications of protein energy malnutrition classifies a weight of more than 90% of the expected weight for that age is normal? A. Syndromal classification, B. WHO classification, C. Gomez classification, D. Classification by Indian Academy of Pediatrics. Correct answer C. Gomez classification. 25. What is caput succedaneum? A. Accumulation of blood between the periosteum and the flat skull bone. B. Presence of forceps marks over the scalp. C. Wide separation of skull sutures. D. Edema of the presenting part of the scalp. Correct answer D. Edema of the presenting part of the scalp. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.